Morning, everyone. Thanks for joining us on Caring for Vulnerable Populations in a Crisis, Screening for Clients and Staff in the Community. Sorry about our technical difficulties this morning. We weren't anticipating any kind of internet challenges when we decided to do the webinar from a different location, but we're doing a recording of it now that we can send out to everyone, and feel free to disperse it among your teams as you see fit. So just a few housekeeping items before we get started. As always, this series of presentations done by Westside Harm Reduction is in collaboration with Street Cred and the Calgary Foundation through a funding initiative through the Boys and Girls Club of Calgary. The presentation and promotional materials are all presented and created by Westside, but we just want to acknowledge Street Cred and the Calgary Foundation prior to starting this presentation, and just thank them for the ability to have this platform that we do right now. And then secondly, just acknowledging of First Nations. So we would like to begin by acknowledging that the land upon which we gather today is Indigenous land. We also recognize that the traditional Blackfoot name of this place, where the Bow River meets the Elbow River, is Mohkinstsis, which we now call the City of Calgary. We would like to acknowledge that we are on the traditional land of the Blackfoot Confederacy, Siksika, Kainai, and Piikani, as well as the Treaty 7 territory, which includes Tsuut'ina and Stoney Nakoda, which is comprised of 3 bands of Chiniki, Bearspaw, and Wesley. Calgary is also home to the Métis people of Region 3. And then last but not least, just acknowledging that, as always, this is a safe place. So everyone is still having some fears. They may be different fears from what they were 6 weeks ago, but there is still fear there out in the community with businesses reopening and lots of the restrictions being removed or just changed. There is a lot of anxiety that does come with that. So these, even though the province is evolving and COVID is evolving, these fears haven't really gone away. They might have changed, but they haven't gone away, and that is completely normal. So understanding that this such situation is stressful for everyone, and it's normal to be anxious and worried, especially with a lot of these restrictions changing in policies and procedures and just dynamics of interactions changing. And then we're not going to do a question period just because it's just me here today, but feel free, if you do have any questions after the presentation, just send them my way or Rachel's way, and we can answer them together for you. So what we're going to cover today, we are going to go over a few updates with COVID-19. So there have been a few updates since the last presentation last week, but then there have been quite a few updates since our first presentation. So we're going to talk about COVID screening for staff, and then client screening. And then I'll go through any questions that anyone might have just via email. So COVID-19, again, it hasn't changed. It's still a large family of viruses found mostly in animals. We've recently seen it in humans, and we saw it in humans with severe diseases such as severe acute respiratory disease, or SARS, or Middle East respiratory syndrome, or MERS. So as of yesterday at 2 p.m., we had 5,836 cases here in Alberta. 67% were in the Calgary zone, so that's up a little bit, or down a little bit from last week, which we were about 71%. So 238 people have been hospitalized, 52 have been in the ICU, and we've had 104 deaths here in Alberta. In Canada, we've seen just under 60,000 cases of COVID-19, and deaths were sitting at about 3,705. Sorry, I might actually have to double check that number. It says, sorry, 3,775. So we are almost at 4,000 deaths here in Canada, unfortunately. Tests completed in Alberta, we're still at about 165,000 tests. So that is fantastic. Like I told everyone earlier, I am one of them. I got tested yesterday, which we'll talk a little bit about testing in a bit here. And then cases in Calgary. So most people on this webinar are in the Calgary area or Edmonton area. Cases in Calgary are just under 4,000. And then we have had, unfortunately, 70 deaths in the Calgary zone. So some COVID-19 updates here. So again, symptoms might take up to that 14 days to appear. So we're no longer saying 2 to 14 days. We're just keeping it at that up to 14 days aspect. There are 2 different types of asymptomatic transmission. So there's pre-symptomatic transmission. So this is, you know, this person is sick, but they just haven't developed symptoms yet. But they can still spread the virus. And then asymptomatic is they actually never develop symptoms. So they are positive for the infection, but their body just doesn't actually get sick, but they can still give the virus to other people here. And then with updates in regard to testing updates, we are not really using the nostril swab much anymore. We are still using the nasopharyngeal swabs when they are available. So there is still a global shortage of them, but they are using them in like ICU cases. And if they have to do anything to get respiratory or lung droplets, they're using the nasopharyngeal swab for that. A lot of places are using the throat swab. So I know a lot of the screening and testing centers around Calgary are using this throat swab. I had one yesterday. To be honest, it wasn't that bad. They're just swabbing both tonsils and then the back of the throat. So one of the reasons why they're not using the nostril swab anymore is they were finding that they were just having a problem communicating the proper technique to properly get the nostril swab to the effectiveness of the nasopharyngeal swab. So with so many different people performing this test differently, the results just weren't accurate, and the efficacy of the test just wasn't there. So they switched to the throat swab, which is easier to have everyone on the same page with testing protocols. So if we're looking at efficacy of the test between a throat swab and a nasopharyngeal swab, they are very, very similar. Throat swab, to be honest, is a bit nicer than the nasopharyngeal swab, but the efficacy and the accuracy of them are very similar in retrospect. So if you're getting a throat swab, it's just as accurate. So testing symptom criteria has changed as of yesterday. So it's no longer just like cough, shortness of breath, sore throat. They've now added kind of painful swallowing to the sore throat, vomiting or diarrhea, muscle aches. So that includes headaches, fever or chills, sudden loss of taste or smell, and then runny nose. So if you have any of these symptoms, you qualify to get tested for COVID-19, or if your clients have any of these symptoms, they do qualify to get tested. Also, their criteria has changed in regards to if you are in a high outbreak center, you don't have to have symptoms to get tested. And obviously they're testing like close contacts in larger amounts right now as well. And something that is new and exciting as of last week is Alberta has launched the AB Trace Together app. So this is a really cool app that's going to help partner notification and CDC locate anyone who has been in contact with a COVID-19 case. So it's just an app on your phone. You can, it doesn't matter if you have like an Apple phone or a Microsoft phone, or it doesn't actually matter. You can just download the Trace Together app. It's a free app that you can download. And basically what it does is it just asks for like your name, date of birth, your phone number, very like brief information. And it uses the Bluetooth on your phone when you're out in public and connects with anyone who's 2 meters away, so that if you do become positive, Alberta Health can ask to get those records, and then they can notify everyone that you've been in contact with or within that 2 meter distance within kind of that 3 or 4 days prior to you having symptoms. And then when you did have symptoms kind of before you were tested, any of that time frame when you weren't necessarily self-isolating, so that those people, they can be contacted to get tested. So anyone who has this app can get essentially contacted from contact tracing for that. So I think it's a really great idea. I've downloaded the app. I think it's fantastic. I mean, we're all in grocery stores or Walmart, or even just like walking in public where people are kind of within that 2 meter radius sometimes. And obviously we're not getting their phone numbers. So it's the more people that have this app, I think the closer we can come to calling it quits for COVID-19 and just getting everyone tested who needs to be tested and reduce the spread of this infection. So this is a really great app that I just wanted wanted to mention. And then last but not least with updates is, I know this says like kindness for the win, and we all work in harm reduction, and stigma is something that we deal with very often, and we're always advocating for our folks and our clients. But I just wanted to touch on just a friendly reminder. I was listening to Dr. Dina Hinshaw's speech last night, and she was just really reiterating the fact to be kind to people. So we're all in this together. This pandemic is new and scary for a lot of people, and stigmatizing individuals based on culture or race or ethnicity or where they work really it's not helping alleviate fears for anyone. And it's not helping get rid of any anxiety. If anything, it adds to it. This perceived stigma could have an impact on individuals' willingness to self-report symptoms or go get tested, and especially if they're high risk or they work in a certain area. And we really don't want to negatively impact anyone's ability to go get tested. And we don't want to create this stigma around COVID-19 where people aren't willing to go get tested or disclose symptoms, because that just creates an environment where COVID-19 will spread rapidly, and we'll be right back to where we started. So just a reminder that, we're all human, and it's nobody's fault who gets this infection, and that we're all in this together. We're all here to support one another, and we need that support as opposed to stigmatization. And this is something that individuals like working in harm reduction, we are very well aware of, right? That support aspect over stigma is what works and what is beneficial. So we need everyone to kind of come together on this. And when people are stigmatized or targeted, it blocks our collective ability to control the spread of COVID-19. So just our friendly reminder to be kind to one another and try to avoid that stigma aspect here. So getting into kind of our screening with COVID-19. So if we're talking about staff screening, so talking about like that questionnaire, do you have a new or worsening fever, sore throat, cough, shortness of breath, runny nose, muscle aches, all those symptoms that we've talked about numerous times with COVID-19. So having that kind of questionnaire with staff, and going through that with them, having them answer all those questions before they come into work. Have you been in contact with someone who's a probable case or confirmed case of COVID-19 without proper PPE? So that's without social distancing, without your mask, without gloves, without goggles. So all that appropriate PPE in the workplace. So make sure you're asking your staff these questions or having them fill out a questionnaire before they come into work. Getting them to wash their hands kind of right when they get into work so that they're entering, their hands are clean when they get into the workspace, so they're not bringing any bacteria or viruses from home or the community back into work. And then it isn't a bad idea to do a temperature check on staff prior to starting their shift. Since fever is one of the measures that we can take that we can actually monitor. And it's not just, I know we all trust our staff, we all respect our staff, but it's nice to have something that we can actually document and even see a trend. So if we gradually see, we know our temperature is generally rising, we can self-monitor that from home. But if your staff are answering yes to kind of any of those questions, so have you been in contact with someone, or I know like kind of that traveling aspect really isn't that big right now because people haven't traveled in a few months. But if you do have a staff member that has just come back from another country, make sure that they are self-isolating for that 14 days. And then in terms of if your staff does come in and they do have a sore throat or fever, make sure they're isolating for 10 days. And then we'll go through kind of that process, what staff need to do if they are sick here. So here we go. If staff are sick, so as of March 25th, Albertas are legally required under the Public Health Act to self-isolate. So with that public health order, they have, like, there are fines that could be in place if you get caught not self-isolating, that kind of thing. But 14 days if they've recently returned from international travel or have had a close contact with someone of COVID-19 without that proper PPE. 10 days if they have a COVID symptom that is not related to a pre-existing illness or health condition. So I say 10 days, and I say that very liberally, just in the aspect. So it's 10 days or until your symptoms resolve, whichever is later. So say you, and same with the 14 days actually as well. So say you came back from Phoenix, you'd been home for 5 days, then you started to feel ill. Well, that day 5 is technically your day 1. So you need to add on those 14 days from the day you feel symptoms. So, or if you've been in contact, kind of that kind of thing. So, and same thing with 10 days if you have a COVID symptom. So if your symptoms start to get worse on like day 8, well, you need to keep going. So, and then taking that COVID-19 self-assessment. So there's a health worker and frontline staff self-assessment that I went through kind of last day. It's really great, and it's easy, and you can it actually prevents you from calling 811 as well. So, and just from my personal experience with it, when I filled out, they just asked like your name, your date of birth, your personal health care number, an email address. They actually ask for your, like, where you work, your manager's name as well. And then they actually call you from there. So I got a call in probably 3 hours after I had submitted that. And then they did kind of a pre-screening, and then a public health nurse called me and told me like where to go for testing. So it was all done very, very quickly just through that self-assessment. So it does save you being on hold with 811 or Workplace Health and Safety or whoever you're calling. So that is an option that you can use as well if you're sick or just not feeling well. And it's very easy. And anyone who's working frontline, they're trying to get individuals cleared and back to work as quickly as possible. So yeah, if staff is sick, that's kind of the process you just need to go through is make sure you're reporting it to your manager, letting your manager know or your supervisors know when you first became sick, what your symptoms looked like, and just keeping them updated on the process. For kind of staff who are working frontline right now, again, they've got centers set up all over the city. If you're in Calgary, they're just drive-through centers. So they give you kind of a window of time. So for me, they're like, be there between 12 and 12:30. I was like directed by like a security guy. They just asked me a few questions to have like my ID and my healthcare number with me. And I literally like drove into a tent. A nurse came out all gowned up, saw my ID, went back in, grabbed the swab, gave me a quick swab, and then kind of sent me on my way. So if you're working frontline or you're a healthcare worker, they are expediting those results for you. So they're about 24 to 48 hours. My results were actually back in less than 24 hours, which is really nice. I'm going to air high five everyone. COVID negative. I just have a very bad flu bug. And then for like kind of the general public who is not working frontline, it is about that 5 to 7 days for results. They do ask for your doctors if you have a family doctors, just so that those results can get there quicker. I know they do ask right now for kind of a release that you can get just like a notification on your voicemail if you're negative. So it's just like a pre-recorded thing that they call. That way you're not like standing by your phone wondering, oh, I missed calls, because they all come from like blocked numbers. So they're just so kind of people are aware if they do have to go through that process, or if staff going through that process, that they know just what that looks like. But in terms of staff screening, the best thing you can do is make sure you're really vigilant with those questions, doing temperature checks, washing your hands, and having that process kind of like right at the beginning of your shift, right when you enter the building. So client screening doesn't really change much in terms of what we're doing for clients as opposed to staff. So when they first come in that building, if you can have a section set up where there's an area where they can either use hand sanitizer, so an alcohol-based hand sanitizer, or wash their hands with soap and water for 20 seconds, just so that you know all those bacteria and viruses that they could have picked up from kind of their environment are gone before they enter the building. And then being very diligent with those questions. So again, do you have a new or worsening fever, sore throat, cough, shortness of breath, runny nose, muscle aches? Have you been in contact with someone who's a probable case or confirmed case of COVID-19? Other questions you could be asking right now, just in regards to some of the shelter or DI outbreaks, like, have you been at Alpha House? Have you been at the drop-in center? Where have you been sleeping? That kind of thing, just so that you are aware of where people have been sleeping. And I know it really isn't a bad idea now if your site has the capability and this resources to do this, but just to keep track of, or your agency, sorry, if you can just keep track of where clients are sleeping and what services they're accessing through the day, whether you just stick it in like kind of an Excel sheet so you can monitor just like, hey, this is where you're sleeping tonight. This is kind of your regular sleeping zone, whether it's like Alpha or DI, or they're housed in permanent housing or they stay with friends, that kind of thing, just so that we, as an agency, you have a general idea of whether or not we should be getting them tested if they've been accessing kind of services where there has been an outbreak. I know with lots of the shelter settings here in Calgary, they are just doing a screen for all, just because there has been some cases within those centers. And then again, taking the client's temperature prior to or at the organizational entrance is a really good idea as well. Just sometimes our clients are not the best. They might have a hard time remembering their symptoms, or they just don't want to disclose. So they might not disclose that they have a sore throat or a cough or shortness of breath, or they might always have a cough or a sore throat or a runny nose or muscle aches, depending on substances that they're using, that kind of thing. And sometimes they're just not the best historians as well. So a temperature is something that we can monitor and can visually see and track, same within our staff populations. So it is a really good idea to take a temperature. In terms of what you should be using to take a temperature, you can use one that like just touches the face and kind of goes down by the ear. Some organizations are using kind of like thermal guns, so you kind of stand a little bit of distance out, kind of this far away, and kind of just point at the forehead and it reads the temperature. I really do like those because then they're no contact and you don't constantly have to be sanitizing it, all that kind of stuff. One thing that I would recommend if you are going to use kind of the thermal, they call it like a point and shoot temperature monitor, is that just pre-warn your clients, because you are pointing something that looks similar to like a gun at their head. So what I've been saying is just like, hey, we've just switched kind of our temperature monitoring practices. We're using this little machine. It doesn't actually touch your head, but I do just point it at your forehead, just so that you're not like alarming clients and causing some trauma with that as well. So in terms of client screening, that's kind of best practice for what you should be doing prior to entering an organization. So what do you do if there's a positive COVID screening, and kind of what to do next when we're looking at kind of staff? What should staff be doing to help like our clients and all of that? So if a client tests positive in your site, the initial screening, so cough, sore throat, fever, shortness of breath, muscle aches now, diarrhea, vomiting, trouble swallowing, change in taste or smell, chills, those kind of things. So you want to put a mask on the client right away. Get them to wash their hands if they already haven't. If you do have a set of gloves, you can stick some gloves on your client as well. And if possible, get them to social distance from other clients. So it's really great if you have an area within your organization that is set up to isolate clients from others. So just like an isolation area, then you're going to call to have that client swab. So in a lot of the DI centers or Alpha, like they're doing kind of swabs within their site. CCT is doing swabs. SafeWorks Outreach is doing swabs. Any urgent care is doing swabs as well. IOT, if your clients are with IOT, the IOT team or MOTE teams, they are also doing swabs. So there is lots of people who are screening within the community. So just call to have someone come to have them screened. Again, with our clients' results, it could be 5 days before we get those results back. But they are working as fast as they possibly can. And then in terms of where does that client go? So what does that look like? So there is a few different options, right? So I know Alpha and DI both have isolation spaces within their site, and also there is the isolation hotel right now in Calgary where our folks can go. So that process you can be referred through like urgent care or DI and Alpha, that type of thing. And I can get you kind of that referral process. We can talk about that and send that out and on what that looks like for a referral process. But it's basically any urgent care can make that referral as well. And then they do take a certain amount of admissions every day. They do have a cap, and that just depends on kind of their staffing and their needs. It is a hotel that is in a discrete location. They don't actually disclose where the location is, just to keep it confidential for clients and to keep it a safe space. In that hotel, they are doing kind of safe supply within there as well, and then managing that detox aspect, because once individuals are in the hotel, they don't leave. So they are managing withdrawal, that type of thing for alcohol and benzodiazepines, as well as like opioids, that type of thing. So it is a really great service that clients can get referred to, just to keep them safe and to keep them isolated when they are having symptoms, so that we can stop the spread of this infection. Okay, so in terms of screening, that is pretty much kind of screening 101. So the main things that you want to make sure that your staff are doing is being very diligent with those questions. So making sure you are asking every single person that comes into their organization, like, are they having any symptoms? Have they been in contact with a known or probable case of COVID-19 or anyone with influenza-like illness recently, so in the past few days? Also kind of looking at like where your clients have been sleeping, what services they've been accessing, that kind of thing. So being very diligent with those questions and asking every single time they come in, because those, as we know, our clients are very transient, and their situation changes frequently. Making sure you're getting them to wash their hands when they come in, and then a temperature check is a really, really nice add-on, just to be diligent with screening, and then knowing kind of what to do if they do test positive for any of that screening. Where can you go? So making sure you're calling them to get swabbed, and then either referring them to the drop-in or Alpha to their isolation rooms, or urgent care can call for the isolation hotel here in Calgary. So it is a pretty kind of simple kind of few step process that staff can go through. So just monitoring symptoms, temperature checks, and then call, mask, gloves, wash hands to make sure we're reducing that spread, and isolate them as best as you can. So again, we do have those infographics from Westside Harm Reduction. If anyone hasn't seen them or doesn't have them and would like them, I'm happy to send them your way. Just send me a quick email. So we have one on FAQ and shelter and drop-in centers, and then we did just have one on the outbreak as well. So kind of what to do, hand washing, that kind of thing. And then this one is more kind of just a question and answer. Again, we're not going to do a question and answer period here, but if you do have any questions, feel free, send me an email at info@westsideharmreduction.com. I'm still self-isolating, so I'm just kicking it at home. So feel free, bug me with your questions. I'm happy to answer them, and we'll get back to you as soon as I can. We do have another webinar on Friday, and that's on kind of what your organizational setup should look like right now. So with restrictions being eased up and a lot of organizations getting back to work, what should that setup look like, and how can we keep everyone safe and reduce the spread of infection while also allowing those services to our clients. Again, so sorry for this morning for the delay in this video, and sorry we couldn't have kind of an interactive video with this, but I hope everyone is staying safe and staying healthy, and I hope to see you all on Friday. I hope you have a great day.